benefit your outdoor summer plans because of fatigue, weight gain, or depression, you can shed the unwanted pounds and those symptoms and start feeling better once you discover the underlying cause of your symptoms. Here to explain, welcome back the founder and CEO of Hotze Health and Wellness Center, Dr. Stephen Hotze.
Thank you, Deborah.
All right, there are a lot of us who we see there's more information than ever to see how we can lose weight and feel better and the whole bit. But there's a large group of us where you look at the doctor and say, but I don't eat that much. And I am doing what you told me to do. And we're not losing the weight. So there could be a reason for that a lot of doctors overlook.
Well, there is a reason for that. There's always a reason for weight gain. Either we're eating too much, or else if we're not eating too much, we're eating normally, we're gaining weight or can't lose weight. That indicates our metabolism is slowed down. And so you have to ask the question, what causes a person's metabolism to slow down? In other words, they don't produce enough energy. So anytime they eat, they're going to end up gaining weight with a low metabolism. Well, there's several things that can cause that. Primarily, we think of a low thyroid condition. The thyroid gland's in your neck, and it produces thyroid hormones. And the thyroid hormones enter the bloodstream. They've got to get into the cells of the body. In the cells, they make the cells, they drive the engine in the cells, so the engine has energy. And without enough thyroid in the cells, the engine slows down. The cells slow down. They become sluggish.
Yeah, you're in park.
Right.
Yeah.
That's right. Now, that can be caused by two things. Either you don't produce enough thyroid, or you're not able to properly assimilate, get the thyroid into your cells. And that can be caused by hormonal imbalance.
All right. The top 5 clues that hormonal decline is the cause of your weight gain. One is you're eating healthy, doing the right thing.
Eating healthy and not losing weight. Exercising and not losing weight, symptoms of low thyroid condition, symptoms of hormonal imbalance. Those are 4. What's the 5th?
Yeah. Well, some people will say, but I take Synthroid or I take such and such. I'm taking thyroid medication.
Synthetic thyroid. So you may have the symptoms of low thyroid, but you've been diagnosed with thyroid and you're on synthetic thyroid, and you don't have any improvement in your thyroid symptoms.
Yeah, and we talked about that a little bit earlier, how bioidentical, your body thinks it's producing its own thyroid.
Right.
Whether when it's synthetic, most people's bodies are going, okay, now what is this again?
The synthetic thyroid isn't even the active thyroid. It's the inactive thyroid hormone that the body has to convert to the active thyroid hormone. And if you have a problem at the cellular level where you don't make good conversion, then it really doesn't do any good. So here's what you look for. Here's symptoms of low thyroid: fatigue, difficulty with weight, cold sensitivity, inability to focus or think clearly,
headaches,
insomnia, headaches, joint muscle aches and pains, some stomach disorders, maybe sluggish bowel function,
depression,
mood swings, these sort of things. Also, then we get hair loss, puffiness, pale.
Changes in skin. Basically, you're falling apart. Right. That's really what I was there.
Think about it. If your body doesn't produce enough energy, and the thyroid hormones enable your cells to produce and use energy, so if you don't produce enough energy, your body's going to run slow. Things aren't going to work as well.
Yeah.
You don't grow, your hair falls out, you get dry skin.
It affects your immune system.
Yeah, and one thing we see with people with low thyroid is oftentimes they'll get recurrent infections.
Okay.
It's hard to clear up. So, now what can cause that thyroid? It's either low production or you don't get them into the cells, and that's because women, as they march through their menstrual life, they have some hormonal imbalances that occur. The shift between estrogen and progesterone during a monthly cycle can adversely affect the body's ability to use thyroid hormones. And your body ends up producing antibodies to thyroid hormones as you grow older and you have estrogen dominance.
And I want to mention, too, that with hypothyroid, I guess hyper maybe also, is that women can have fertility issues, and sometimes that's overlooked.
Very common problem is infertility. The first thing a doctor ought to think about is thyroid.
Because it's fairly easy to fix.
You just give a little thyroid, and the other thing is miscarriages. Recurrent miscarriages can be a low thyroid problem. Irregular menstrual cycles can be caused by a low thyroid problem as well. And as a woman marches through her menstrual life, as her hormones become imbalanced, she can have some menstrual irregularities as well.
All right, so diagnosis is important. You listen to the symptoms as opposed to just take a test, because people say, oh, but you're within the range.
Well, unfortunately, because of HMOs, PPOs, and the way doctors' offices have to run now to be profitable, you got to see patients very quickly. So instead of relying on a history, taking a good history, they simply take a blood test. If your blood test falls within this broad range of normal, they say you're fine.
Yeah.
And if you have these symptoms, everything's fine on your blood test, and we recommend antidepressants or sleep medication.
Addressing the symptoms.
Yeah, trying to address the symptoms with drugs, rather than listening, taking time to listen to the patient, listen to her symptoms or his symptoms, and seeing what they line up. And if the symptoms are consistent with hypothyroidism and hormonal imbalance, then it would be proper to give the patient, or guest as we call them at our center, give them a therapeutic trial of that preparation of thyroid.
Yeah, because one thing I would say with the Hotze Health and Wellness Center, you keep constant communication,
right,
and you make sure that, okay, we did this, how do you feel? Not just, I gave you this, what's wrong with, how do you feel? And then you keep in touch, and then detoxification, and you make us a partner in our health. So,
that's right. Well, the other thing, and you mentioned something, on detoxification, toxins in the environment are hormone disruptors, and they adversely affect thyroid function and your sex hormones as well.
Yeah. All right. Well, Dr. Hotze has written 2 books about hormones and hypothyroidism. Visit hotzehwc.com/GDH to get your free copies today. And that way he breaks it down how you can understand how hormones really impact your body, and you can kind of figure out whether that's what's happening with you. All you have to pay is for shipping. And everyone in today's studio audience is going home with a copy of Dr. Hotze's book. And for more information and to make an appointment with Hotze Health and Wellness Center, you can call this number. It is 888-473-5531, 888-473-5531. Thank you. Well, last week proved Mother Nature can take over in an instant. So will you be prepared next time? What to do first when we come back?